over there.
Get on up.
Everybody right there.
Get into it.
Everybody right there.
Get involved.
Everybody just come on now. Come on now.
I'm here with Heather Smith, who's the sales director from Univera Healthcare. Thanks for being here with us.
Thanks for having me.
So Heather, could you tell us about who is eligible for Medicare?
Sure can. Anyone that is turning 65 and that will be looking at possibly retiring, or even if they're not retiring, they may still be eligible for Medicare and want to pick up Parts A and Part B. So anybody aging in or turning 65, as well as anybody that's been on disability for more than 24 months, if you're receiving Social Security disability, you could also be eligible for Medicare.
Okay, great. And in terms of what people who are maybe aging in or are needing to start thinking about Medicare, what should they be doing?
Sure. First step is they need to set up their Part A and Part B. Part A is usually automatic, but Part B is not, depending on what your employment status may or may not have been recently. So you want to make an appointment. You can either go on Medicare.gov or make an appointment with your local Social Security office, and they can help you in getting that started.
And what are Part A and Part B?
Great question. Part A and Part B, which are also known as Original Medicare, is what is actually supplied by the government. So Part A covers hospitalization, and Part B covers your provider services. If you just had Original Medicare by itself and no other supplemental plan, it would cover about 80% of your healthcare costs.
Okay. And what would you say are some of the big mistakes that people make that cause them to have to pay some sort of fee?
So some pitfalls that you can have is not signing up for Part B when you became eligible. There are some circumstances where you may not need to. I talked about staying working past 65. That there's some caveats in that. If you're staying working and based on the size of your employer, you may not need Part B, but you need to make sure that you find that answer out, because if you do need Part B and you did not sign up for it when you became eligible, you will receive a penalty, a financial penalty that you will have to pay for not signing up when first eligible.
Are there any sort of other penalties that are common?
There's one more penalty that is possible, and that's called a late enrollment penalty. It pertains to your Part D, or prescription drug coverage. So a lot of folks that I'll talk to, they say, I don't really have any prescriptions. I'm not interested in signing up for a Part D plan at this time. And I always tell them, please do, because even though you may not need the coverage right now, you may in the future. And the penalty that you incur from Part D late enrollment penalty, once it's calculated, it is a monthly penalty that you will have for the rest of your life. So it could, over time, become quite expensive.
Okay, good to know. All right, well, thank you for being here with us today.
Everybody over there.
Get on up.
Everybody right there.
Get into it.
Everybody right there.
Get involved.
Everybody just